Right now, while you are watching this, there is something happening inside millions of seniors across America that has absolutely no pain attached to it. No dizziness, no chest tightness, nothing that would make you put down your coffee and call your doctor. And yet, it is quietly raising the risk of stroke and heart damage in people who are doing everything they think is right. People who exercise, people who eat carefully, people who take their supplements every single morning because they want to protect themselves. And one of those supplements, one of the most trusted ones on the shelf, is the exact thing creating the danger when it meets the wrong medication. If you take vitamin B12 every single morning, stop and watch this before you take your next dose. Because as a healthcare professional, I have seen this exact combination quietly damage hearts and raise stroke risk in people who are doing everything right. Stay with me for the next few minutes because what I am about to show you is something most people over 60 have never heard from anyone. My name is Dr. Jennifer. Over the years, I have worked with thousands of seniors to optimize their metabolic and vascular health. I've seen patients who manage their blood sugar perfectly, watch their blood pressure like a hawk, and still ended up facing a minor stroke or a cardiac event that seemed to come out of nowhere. When we dug deeper into their daily routines, a pattern emerged. The interaction between vitamin B12 and two of the most common medications found in almost every medicine cabinet today. In the next several minutes, I am going to show you exactly which two medications are dangerous to combine with high dose B12 after the age of 60. I'm going to explain what happens inside your body when you take them together, and I am going to show you how to protect yourself starting today. Before I go any further, I want to ask you one thing. Type your age in the comments right now. Just your age, because what I am about to share hits differently depending on how long you have been taking these medications. Now, here's something worth knowing before we go deeper. A study published in the Journal of the American Medical Association found that seniors who took high-dose B vitamins, including B12, over an extended period actually showed increased cardiovascular risk under certain conditions compared to those on lower doses. Not decreased, increased. That finding stunned a lot of people in my field. But when you understand the mechanism, it makes complete sense. And that mechanism is exactly what I want to walk you through today. But first, I want to tell you about Dorothy. Dorothy was 71 years old when she first came to me. She was sharp as a tack, retired school teacher who walked every morning. She took a handful of supplements every day with her breakfast because she knew that after 60, the body stops absorbing nutrients the way it used to. B12 was at the top of that list. What Dorothy did not know was that she had been on metformin for type 2 diabetes for nearly 8 years. And for 8 years, nobody had ever explained what metformin does to B12 absorption over time or what happens when the body tries to compensate. Her daughter noticed that Dorothy had been getting more tired than usual, not sleepy, just drained in a way that sleep did not fix. When I pulled her blood work, her B12 levels were actually high from supplementing, but her homocysteine level was dangerously elevated. The first medication I want to talk about is metformin. If you have type 2 diabetes, there is a very good chance you are on it. It is genuinely effective, but it has a side effect that most patients are never clearly told about. Over time, metformin interferes with something called intrinsic factor in your gut. Think of intrinsic factor like a taxi. B12 gets into the taxi, and the taxi drives it into your bloodstream. Metformin quietly damages that taxi system. So your doctor sees low B12 levels and says take a supplement. You go out and buy a high-dose B12 tablet, and for a while, your blood levels look fine. But that blood level is not showing you what is happening downstream. Because when B12 cannot be properly processed, it begins to interact with another molecule in your blood called homocysteine. Homocysteine is an amino acid your body produces naturally. But when the conversion process is disrupted, homocysteine builds up and acts like sandpaper on the inside walls of your arteries. It does not cause a sudden blockage like a clot. It causes chronic abrasion. It inflames the arterial wall and makes it stiff. Think of your arteries like a flexible rubber hose. When they are healthy, they stretch. When homocysteine has been scraping those walls for years, the hose becomes like a rigid plastic pipe, and rigid pipes crack. In the cardiovascular system, a break like that is a stroke. The second medication I need to tell you about is one that even more people are taking: proton pump inhibitors, commonly known as PPIs. These are medications like omeprazole and pantoprazole that reduce stomach acid. They are extraordinarily common among seniors because acid reflux increases after 60. But PPIs reduce the stomach acid that is necessary to release B12 from food in the first place. Your body needs an acidic environment to break down the protein bonds that hold B12. When you reduce that acid over years, your dietary B12 absorption drops. The problem is that in certain individuals, especially older adults with reduced kidney function, a B12 supplement is not cleared efficiently. It accumulates in the blood in a form that interacts poorly with the homocysteine cycle. When was the last time your doctor asked you specifically whether you were on a PPI and also taking B12 at the same time? Type never in the comments if that is the case. This is why it matters so much. Homocysteine is almost never tested on a standard blood panel. Your doctor checks cholesterol and sugar, but homocysteine requires a separate test. Yet, when these levels stay elevated, the inner lining of your arteries becomes inflamed, making it easier for plaques to form and, more importantly, making those plaques unstable. This is not meant to frighten you. It is meant to give you the knowledge that puts the power back in your hands. The answer is not to stop taking B12 entirely. B12 is genuinely essential for your nerves and brain. The goal is smarter B12. First, if you are on metformin or a PPI, ask your doctor to test your homocysteine level and your active B12, not just total B12. Second, the form of B12 matters enormously. Most supplements use cyanocobalamin, which is cheap but hard for the body to convert. You should look for methylcobalamin. It is already in an active, usable state and bypasses those difficult conversion steps. Third, the dose matters. You don't need a massive dose of 5,000 micrograms. A targeted dose of 250 to 500 micrograms in methylcobalamin form, taken with B6 and folate, gives the homocysteine cycle everything it needs to function properly. Fourth, talk to your doctor specifically about your medication list in relation to your supplements. That conversation alone could change the trajectory of your cardiovascular health. Take the case of Beverly, who had been on a PPI for 14 years. Her homocysteine was more than double the safe level, yet she felt fine and had no symptoms. We changed her supplement form to methylcobalamin and timed it away from her PPI dose to maximize absorption. In 90 days, her homocysteine dropped significantly. She told me she didn't realize how tired she was until she started feeling better. The body has a remarkable ability to recover when you give it what it actually needs. The vascular inflammation that homocysteine causes is not permanent when caught early. You now know something that most people have never been told. If you want honest health information like this every week, hit subscribe right now. I share what your doctor simply does not have time to tell you in a 15-minute appointment. Hit the like button to help other seniors find this information, and type the word protected in the comments if you are making this change today. Send this video to your partner, your sibling, or your closest friend. You may never know whose life you just changed. I am Dr. Jennifer. Take care of your heart. I will see you in the next one.